I'm very pleased to welcome Kelly Harris. And Kelly Harris, I met, I think it was about 2 years ago. Is it, Kelly?
Gosh, yes, 2 years that's flown by. But yeah, it was 2 years ago we did the initial training.
Yes. And you tell us a little bit about yourself, Kelly, because you came to seek some training at my clinic with my colleague, Kathy McGuinness, and I. And you're a very experienced nurse. You've got a lot of NHS experience, and you've also had a lot of experience in aesthetic treatments, and you've got your own clinic. So tell me a little bit about your background, what you've done so far, and why you felt you wanted to learn more about sclerotherapy.
Okay, yeah. So yeah, that's right. I am an advanced nurse practitioner and I still work part-time for the NHS in primary care and GP surgery. Um, so I started in private aesthetic practice probably about 4 or 5 years ago. And at the time, I was a neurology practitioner and I was running the chronic migraine clinics, and that involved injecting Botox. I was also involved in spasticity management and a few other treatments, neurological treatments that required Botox. So it kind of, my interest stemmed from there really, because people would jokingly ask me, well, you can do this, you can inject my face, and I agreed to it, and we did some treatments, and it kind of grew from there, because what I started to realize about Botox initially, and then that's kind of naturally developed into other treatments, was the well-being and boosting confidence element to aesthetic treatments. And I found I had a passion and a talent from it, and it kind of developed from there. So that's me 5 years ago, and I started out then part-time running an aesthetics clinic. In the meantime, I completed my independent prescribing, which is essential really to be able to, you know, carry out those treatments effectively, efficiently. But also in terms of the sclerotherapy, at the time I was working in a clinic, we were using laser, so intense pulse light, to treat facial telangiectasia. And at the time, people would always ask me to treat their leg veins as well, and I wasn't able to offer a treatment because, well, you know, the evidence, the outcomes for IPL on limbs isn't brilliant. So it isn't something I was able to offer really. So it led me to look into what I could offer for treatment of leg spider veins, and sclerotherapy was the treatment really that I started to look into. I think for me, when I was looking for a training provider, it had to be someone that was kind of expert in their field. Now, there are a range of cosmetic providers that are offering the sclerotherapy, but it didn't quite sit with me that they would be generalist aesthetic practitioners offering this training. And so the obvious choice for me was to find someone who was kind of expert. And so in the Vein Care Centre, obviously you are esteemed vascular surgeons, you've got a great deal of experience within the NHS and the private sector. And that for me kind of felt right in terms of who I'd get my training from.
Ah, that's very kind of you to comment in that way. You're based in Wales, aren't you? So you had to come quite a distance.
Yeah, we're in Swansea, but yeah, traveling was no problem really. And to come for the training, it was a full day training. You're in a lovely part of the world, so it was like a day out, to be honest. And
Yes.
yeah, no, it was no big deal to come for travel training, and I've often done that for the right training. And also after the training, you know, when I came and sat in on your clinic afterwards, that was invaluable. So yeah, no, traveling was never an issue really for the right training.
So how has your practice developed now? Did you feel that the training that was offered to you actually prepared you for starting to provide this service to private patients and start charging, or did you feel a little hesitant to begin with?
I think, like anything, you naturally feel hesitant when it's a new sort of treatment that you're going to be offering. But I have to say, the support from the Vein Clinic, yourself, and you know, the admin staff, the nurses, the whole team really was exemplary. So I was able to ask questions. The communication was excellent. I always felt at ease getting in touch with you to ask things. But the thing that stood out really was in the afternoon when we sat in on the clinic, that was a live clinic with lots of patients, lots of different patients with different presentations coming in. So I felt that I had quite a lot of experience as part of that training day. And it really did give me the confidence to get started when I came back to Swansea and offer that in clinic. Um, the other thing, there was a bit of a delay in me getting started after the training. So that follow-on day that I was invited to go on to was absolutely invaluable, to come and sit in another clinic, ask through those questions that I hadn't asked first time round. Yeah, was just excellent, really.
Now, I don't have any experience of treating the face. Obviously, legs are probably the most distant part of the anatomy you could choose to add to your portfolio. I always look at people who are treating face with fillers and Botox. You can always watch these things on YouTube or see them on people's websites. It looks very scary. When you put microsclerotherapy in the context of what you're already doing, which already seems very skilled and possibly with potentially serious complications. What was your view of microsclerotherapy? Did you find it difficult to do the injections? Was it more tricky than you anticipated? And once you introduced it into your clinic, did you find you had many complications that you had to deal with?
I have to be honest, I haven't had any complications at all. And I really do truly believe that's because of the way we discussed complications, the techniques I was taught, but also I think the honest and frank discussion about the type of sclerosing agent, how that is mixed with water under injection to get that strength that we use in clinic, because there are a lot of different opinions. And so you read the literature and from experts, there'll be a range of different strengths. And what I valued about the training really was we discussed those different opinions and we decided that the best option is to stick with the safer option, which is just as effective but without complications. And what I mean by that is the dilution rates and the strengths of the sclerosing agent. So yes, I've stuck with that, and I absolutely can say that it's an effective treatment without any complications. So I haven't had any ulcerations, any skin wounds, rashes, sores, anything really. And I put that down to the technique I was taught and the aftercare advice and yeah, the little, the real life hints, tips and tricks
Yes.
to make it safe. Yeah.
Yes, I mean, you were very lucky on that day, Kelly. You had Kathy McGuinness spending a lot of time with you, and she has a lot of tricks and tips that she shares. I have to say, I always like sitting in on Kathy's clinics, as I often learn things even now. And as I say, you're always welcome after one of our courses to come back and have a refresher. Now, because of COVID, obviously, we're going to move our theoretical training online, and we're going to base it principally on lectures, videos of techniques and so forth. So how would you feel about learning that part of the microsclerotherapy online?
I think that would be absolutely fine. Obviously, the actual injecting is key, and so I don't. How do you propose that that's going to go? Is that kind of something in the future? Is it going to be in two parts for you, or?
I think Kelly, we're still taking advice, but at the moment, Kathy and I feel that we're going to move the theoretical part based on lectures online. That's going to be a
Yeah.
narrated PowerPoint presentation. And we're going to go in depth on technique using videos, high definition videos, very close up work, again, narrated to show the precise steps in getting the needle into the vein
Yeah.
and showing the successful blanching of vessels and looking out for the earliest signs of a bleb, which is usually an indicator. Well, it's always an indicator that you should stop straight away.
Yeah.
So we think we can cover the theoretical and practical aspects, and we can show the do's and don'ts, and we can go through complications. But you're right; it seems like that would be part one of two parts, where part two would be to come either to our clinic or one of our instructors
Mm.
goes to the delegates
Yeah.
clinic to show them.
I think it's actually a good idea because and where that would have an advantage over me attending and doing the theoretical session would be obviously you can replay that over and over and
Yes,
over.
yes,
Um, yeah, you know, we had some course pre-reading. There was the booklet sent out, and the theoretical session in the morning was excellent. But if you do have that online, yeah, there's that opportunity to go over it. Yeah,
yes.
you know, I think there are some advantages to learning online also, yeah.
The bad news, Kelly, is, well, it may be good news, I don't know. The manual that we sent to you was about 50 pages. It's now
Yeah,
been completely revised and it's over 100 pages. And the manual now has hypertext links, so you can click on the links and be taken via the web to the primary sources, the references.
right.
You can also see demonstrations of YouTube videos. There's lots of YouTube videos there.
Yeah,
So Kathy and I have curated the good ones with hyperlinks, so you can again click on the hyperlinks in the manual and
yeah,
see examples of good practice. And of course, there's our training videos as well that we've done where we show blanching, we show bleb formation, and we show some of the complications that can arise. So yes, it's been improved. So
well, that's
you're in
yeah,
clinic at the moment, Kelly.
yes.
That's great. And I think you've got a patient coming fairly soon, so I won't keep you much longer. Thank you
Okay.
very much for sharing your experience, and I'm really pleased to see or to hear that you're um, continuing with your sclerotherapy. And it now forms quite a significant part of your practice, would you say?
Yes, indeed. Yeah, I've got a real steady flow of patients. Without having to advertise too much, I have to be honest, it seems to have grown organically. I think it's the type of thing that women will talk about readily, more so than even their facial cosmetic
Yes,
procedures.
yes,
And so, you know, I get mums, aunties, sisters, friends, yoga club, you know, friends coming in to say, "Oh, no, you've treated my friend. I've got the same issue. Didn't realise there was something I could do about this." So, yeah, so I've got a steady flow of patients who are having really good results. Um, so, you know, it's quite an inexpensive treatment. The consumables
yes.
are inexpensive. There's no expensive machinery to purchase to be able to carry out these treatments. So, yeah, you know, it's been a great treatment to add to my portfolio.
Well, thank you very much, Kelly. I'll let you get back to your busy clinic and
Okay.
all the best. Let's hope we all get rid of lockdown and we can open up our clinics fully. I know you're not actually treating patients in your
So
clinic
I'm just,
today. I made a mistake about that. I said you were waiting for a I said you were waiting for a patient. You're not waiting for a patient. You did tell me before we came on live that you were actually involved in the training session today.
yeah,
Your clinic, like mine, is closed because of COVID. And we both look forward to the time when we can reopen properly. So thank you very much, Kelly, and
you're
good luck.
welcome.
And we'll speak
Lovely to
again
speak to
soon.
you. Yes, we will. Thanks very much. Nice to speak to you.